Telemedicine has emerged as a transformative force in the healthcare landscape, revolutionizing the way medical services are delivered and accessed. By leveraging technology to facilitate remote consultations and care, telemedicine has expanded access to healthcare, improved patient outcomes, and enhanced the overall efficiency of healthcare systems. As the demand for convenient and accessible healthcare continues to grow, the importance of telemedicine has become increasingly evident. This exploration of telemedicine will delve into its various dimensions, including its benefits, challenges, technological advancements, applications, and its role in shaping the future of healthcare. At its core, telemedicine refers to the use of telecommunications technology to provide medical services remotely. It encompasses a wide range of services, including virtual consultations, remote monitoring, teletherapy, and mobile health applications. Telemedicine allows healthcare providers to connect with patients through video conferencing, phone calls, or messaging platforms, enabling them to diagnose, treat, and manage health conditions without the need for in-person visits. This innovative approach to healthcare delivery has gained traction in recent years, particularly in response to the COVID-19 pandemic, which necessitated social distancing measures and limited in-person interactions. One of the most significant benefits of telemedicine is its ability to expand access to healthcare services, particularly for individuals in underserved or remote areas. Many patients face barriers to accessing traditional healthcare, including geographic distance from healthcare facilities, transportation challenges, and limited availability of specialists. Telemedicine breaks down these barriers by allowing patients to receive care from the comfort of their homes, eliminating the need for travel and reducing wait times for appointments. This accessibility is especially crucial for individuals with chronic conditions, mobility issues, or those who require ongoing monitoring. Furthermore, telemedicine has the potential to improve patient outcomes by facilitating timely interventions. Virtual consultations enable healthcare providers to assess patients' conditions quickly and provide appropriate treatment recommendations. For instance, patients experiencing acute symptoms can connect with a clinician within minutes, allowing for prompt evaluation and management. This timely access to care can prevent conditions from worsening and reduce the need for emergency interventions, ultimately leading to better health outcomes. Telemedicine also enhances the continuity of care, particularly for patients with chronic diseases who require regular follow-up and monitoring. Remote monitoring technologies, such as wearable devices and mobile health apps, allow patients to track their vital signs, medication adherence, and other health metrics. Healthcare providers can access this data in real time, enabling them to make informed decisions about treatment adjustments and interventions. This proactive approach to managing chronic conditions can lead to improved patient engagement and empowerment, as individuals take an active role in their health management. In addition to improving access and outcomes, telemedicine has been shown to enhance patient satisfaction. Many patients appreciate the convenience of virtual consultations, which eliminate the need for time-consuming travel and long wait times in crowded waiting rooms. Telemedicine allows patients to schedule appointments that fit their lifestyles, reducing the stress associated with traditional healthcare visits. This convenience can lead to increased adherence to treatment plans and follow-up appointments, ultimately improving overall health outcomes. Despite its numerous advantages, telemedicine also faces several challenges that must be addressed to maximize its potential. One of the primary concerns is the issue of reimbursement and insurance coverage. While telemedicine has gained acceptance among healthcare providers and patients, reimbursement policies vary widely across regions and payers. Ensuring that telemedicine services are adequately reimbursed is essential for encouraging healthcare providers to adopt and integrate these technologies into their practices. Policymakers and healthcare organizations must work together to establish clear guidelines and reimbursement models that support telemedicine services. Another challenge is the need for robust technological infrastructure and digital literacy. While telemedicine relies on technology to facilitate care, not all patients have access to reliable internet connections or the necessary devices to participate in virtual consultations. Additionally, some patients may lack the digital literacy required to navigate telemedicine platforms effectively. Addressing these disparities is crucial to ensuring equitable access to telemedicine services. Initiatives aimed at improving digital literacy and expanding internet access, particularly in rural and underserved communities, will be essential in overcoming these barriers. Privacy and security concerns also play a significant role in the adoption of telemedicine. The transmission of sensitive health information over digital platforms raises questions about data security and patient confidentiality. Healthcare providers must implement robust cybersecurity measures to protect patient data and comply with regulations such as the Health Insurance Portability and Accountability Act, HIPAA, in the United States. Building trust with patients regarding the security of telemedicine platforms is essential for encouraging their use and acceptance. Technological advancements continue to drive the evolution of telemedicine, leading to new applications and capabilities. Artificial intelligence, AI, and machine learning are increasingly being integrated into telemedicine platforms, enhancing diagnostic accuracy and improving patient care. AI algorithms can analyze patient data, identify patterns, and provide clinical decision support to healthcare providers. For example, AI-powered chatbots can assist with triaging patients, answering common questions, and providing health information, thereby streamlining the patient experience. Moreover, the integration of telemedicine with electronic health records, EHRs, allows for seamless information sharing between healthcare providers. This integration ensures that clinicians have access to comprehensive patient histories, lab results, and treatment plans during virtual consultations, enabling more informed decision-making. The ability to share and access patient data in real time enhances the continuity of care and improves coordination among healthcare teams. Telemedicine has found applications across various medical specialties, including primary care, mental health, dermatology, and chronic disease management. In mental health care, teletherapy has gained popularity, allowing individuals to access counseling and therapy services from licensed professionals without the stigma or barriers associated with in-person visits. This has been particularly valuable during the pandemic, as many individuals sought mental health support amid heightened stress and uncertainty. In dermatology, telemedicine has enabled patients to receive consultations for skin conditions through secure image sharing and virtual assessments. This approach not only saves time for patients but also allows dermatologists to efficiently evaluate and treat conditions without the need for in-person visits. As telemedicine continues to evolve, its role in shaping the future of healthcare is becoming increasingly apparent. The COVID-19 pandemic has accelerated the adoption of telemedicine, prompting healthcare providers and patients to embrace new ways of delivering and receiving care. The lessons learned during this period will likely have a lasting impact on the healthcare landscape, leading to greater acceptance and integration of telemedicine into routine practice. In conclusion, telemedicine represents a significant advancement in healthcare delivery, offering numerous benefits that enhance access, improve patient outcomes, and increase satisfaction. By leveraging technology to facilitate remote consultations and care, telemedicine has the potential to transform the way healthcare is delivered, particularly for underserved populations. While challenges such as reimbursement, technological infrastructure, and privacy concerns must be addressed, the ongoing advancements in telemedicine hold great promise for the future of healthcare. As society continues to navigate the complexities of healthcare delivery, telemedicine will play a pivotal role in ensuring that individuals receive the timely, convenient, and effective care they need to thrive. The journey of telemedicine is ongoing, and its impact on the health and well-being of individuals and communities will continue to evolve, shaping the future of healthcare for generations to come.